Hi, this is Bailey Wynn. Today I'm going to speak to you about my project that incorporates two health behavioral theories in order to bring about a behavioral change in hypertensive patients. The targeted population is African Americans. I chose this group not only due to the prevalence of hypertension in this community, but also the detrimental effects of the disease. African Americans have the highest prevalence of hypertension in the world. More than 40% of African American men and women have high blood pressure. For African Americans, high blood pressure often develops early in life and is usually more severe. Theories abound as to why this is. They believe that it is due to the higher rates of obesity and diabetes among African Americans. Researchers have also found that there is a gene that makes African Americans much more salt sensitive. And people who have this gene, as little as 1 gram of salt, which is half a teaspoon, can raise the blood pressure as much as 5 millimeters of mercury. The name of my project is Put the Brakes on Hypertension. On the next two slides, I'm going to talk to you about the health behavior theories that I chose in order to try to effect a change in the community as it relates to hypertension. The health belief model states that people will actively prevent, screen for, or control disease conditions if they consider themselves susceptible to the condition, if they believe it could have potentially serious consequences, and if they believe that the benefits of taking action outweigh their imagined barriers to taking that action. The health belief model states that people will actively prevent, screen for, or control disease conditions if they consider themselves susceptible to the condition, or if they believe it could have potentially serious consequences, and if they believe that the benefits of taking action outweigh their imagined barriers to taking that action. Social cognitive theory explains human behavior in terms of a triadic model in which behavioral, personal thoughts and beliefs, and the environment interact. Unlike the health belief model, which only considers the individual's role in health beliefs and behaviors, the social cognitive theory considers the individual in the context of his or her own environment. The health belief model is appropriate for this particular project because it has been applied to a variety of health education topics, since this model is based on motivating people to take action. Knowledge of their health risks and benefits creates the precondition for change. So if people lack knowledge about how their lifestyle habits affect their health, they have little reason to put themselves through this difficulty of changing the habits that they enjoy. So self-influences are needed for most people to overcome the impediments to adopting new lifestyle habits and maintaining them. And beliefs about their personal efficacy play a central role in personal change. The social cognitive theory addresses self-efficacy. Self-efficacy beliefs determine how obstacles and impediments are viewed. So those with low efficacy expect their efforts to bring poor outcomes, and obviously those of high efficacy expect to realize favorable outcomes. So people of low efficacy are easily convinced of the futility of their effort in the face of difficulties. They quickly give up trying. Those of high efficacy view the impediments as surmountable by improvements of self-management skills and effort. They stay the course in the face of difficulty. In her article, in which she proposed a new model for treating African Americans with hypertension, Dr. Jennifer Middleton discussed how advantageous the health belief model and the social cognitive theory were in reducing noncompliance. If you'll notice on my intervention slide, one of the things that Dr. Middleton talked about was the fact that African Americans really did better when there were people who worked with them from health professions that they trusted. Secondly, she talked about the fact that blacks or African Americans in this country tend to watch more television than other segments of the population, and that using popular media, whether it's print or visual, broadcast media, that these are ways in which the community can be reached and given the information they need to make informed choices as far as their health is concerned. So I have included that in my project, the media blast in targeted communities. Also, the idea of providing exercise space. One of the things that was talked about is the fact that African American women are less likely to exercise, and some of the barriers had to do with affording gym memberships and then also access. So I looked at the fact that we could create exercise space in churches, some of the schools and recreational centers that were easily accessible by the targeted population. Also, the fact that the community tend to do better if there were people who looked like them that also came out and support the program. So it's important for me to include religious people from the religious community, business owners, and advocacy groups that the community would more likely to recognize as part of their community. In conclusion, an approach that attacks the problem of noncompliance in hypertensive patients in the community from several angles has been shown to produce the best results. Using the health belief model and the social cognitive theory to change perceptions about the seriousness of their disease, as well as fortifying the belief that they can change behaviors which negatively impact their health, will help to put the brakes on hypertension in the Black community. Thank you. Any questions?